unfortunately, those VADs can't be used in every anatomy for children who need heart transplant, but it can be used in many, and it has definitely changed the way we're able to provide care to our patients. Changes in immunosuppression have occurred in the last 25 years that have given us the ability to use immunosuppression that's less toxic on the body, allowing our patients to live longer and to enjoy their lives better. And even something as straightforward as family-centered care, which is something that the new hospital embraces. Not only is it the support then for the patient, but it's also for the family and the caregivers of the patient. And you're included so closely with the decisions the medical team makes and with the care of your own child. So there's been a lot of significant changes that have occurred in the last 25 years. I am here to do the welcome and the thank yous, and then Dr. Menteer is going to talk a little bit more about the future of transplant. But I do want to thank a number of people that have made this program possible. First, I want to thank all of you and all of the patients of our families and all of our patients for putting your trust in this institution, in this team, and for making today so amazing, and actually every day that we come to work so amazing. I'd like to thank the surgeons and the cardiologists and the coordinators who work tirelessly at all hours of the day and night to provide care for these patients, for our patients. I'd like to thank our nighttime warriors, and sometimes get forgotten, but these are the people that actually go out and do the procurements at 2 o'clock in the morning, or go look at the heart to see if it's good or not. And thank the teams of residents, professionals, surgeons who have gone out and done that. Also, our CTICU and our OR teams who are just amazing, providing care at probably at the most needed time in the patient's life. And then the rest of our transplant team, which includes our dietitians and physical therapists, occupational therapists, social workers, care managers, the administrative staff, everybody that surrounds the program to make this incredibly complex process a reality for our patients. And then finally, I would like to take a moment to thank the donor families who provide us the gift of life so that we can continue doing this work and helping those individuals who don't have any other choice. I'd like to just give thanks to the donor families. Dr. Menteer is going to be up next, and then I will be back to chat with you a little bit in a bit.
Hey everybody, can you hear me? Loud. I have a lot to say. Let's see if I can get through this without crying too many times. This is awesome. I actually can't believe that this came together like this, because we have never had this many of our present and former patients and our staff room in one place at one time. Awesome. I'm going to hope that what I have to say doesn't get us down too much, because I think that there's, but I do want to say some kind of heavy things. We're here, we're assembling to celebrate a milestone, the 25th anniversary of CHLA's thoracic transplant program. I do want to take the time to celebrate the accomplishment and remember some momentous achievements, but I also want to take some time for us to center ourselves about what's really at stake. And just what a huge responsibility it is for us to steward these invaluable gifts that are bestowed upon us by our donor families. Breaker. Really? I'm going to talk louder now, because I don't think I can hold that the whole time. 25 years is a pretty long time in terms of a professional life. And when Dr. Starnes came here to CHLA, he brought with him a vision for CHLA's Heart Institute, and part of that vision included taking care of all the children that he could, including the ones that had hearts that were so sick or so malformed that he couldn't fix them with heart surgery. Our transplant program was born of the vision of Dr. Steins and the devotion of Monica Horn and the fearless enactment of a shared vision by many people before me. Pierre Wong is back there somewhere, Dr. Takahashi, Dr. Badran, who's back on the program, back on the team again, Dr. Jackie Schmishkovitz, where she went back there. And our present team, including Dr. Harrington, of course, Dr. Sue, who can't be here with us here today. Of course, Monica, Donna, Debbie, our tireless coordinators, without whom we would all, patients and doctors alike, all probably be dead. I would also like to give special mention to Carolyn Buckley. She's been with the team for an endless period of time, long before me, and she's still not only our best and strongest social worker, she's also actually the team psychologist, although she doesn't have the degree to prove so. Over the past 25 years, the outcomes metrics of this program are absolutely second to none. And I don't think that those numbers matter much at all to almost anybody here, because to everybody here, there's only one number that matters, and that's the survival of the one person in your family that had a heart transplant. There's an eerie arrogance, I would say, when talking about survival statistics and complication rates for organ transplant recipients. I'm not going to go there. I just want to rejoice in the successes of those recipients that are with us here today, and there's so many of you. It's unbelievable. And I want to remember the fighting spirit of those that didn't make it here today. I want to also acknowledge the unending gift that came from each of those donors that made this program possible. On that last note, I want to take a moment. Some of you have read Robert Test's poem, To Remember Me. It's fairly brief, and I'd like to take a moment to just read it to you as we remember the donors. To remember me. The day will come when my body will lie upon a white sheet neatly tucked under four corners of a mattress, located in a hospital busily occupied by the living and the dying. At a certain moment, a doctor will determine that my brain has ceased to function and that for all intents and purposes, my life has stopped. When that happens, do not attempt to instill artificial life into my body by use of a machine, and don't call this my deathbed. Let this be called my bed of life, and let my body be taken from it to help others lead fuller lives. Give my sight to the man who has never seen a sunrise, a baby's face, or the love in the eyes of a woman. Give my heart to a person whose own heart has caused nothing but endless days of pain. Give my blood to a teenager who is pulled from the wreckage of his car so that he might live to see his grandchildren play. Give my kidneys to one who depends on a machine to exist. Take my bones, every muscle, every fiber and nerve of my body, and find a way to make a crippled child walk. Explore every corner of my brain. Take my cells if necessary and let them grow so that someday a speechless boy will shout out at the crack of a bat, and a deaf girl will hear the sound of the rain against her window. Burn what's left of me and scatter the ashes to the winds and help the flowers grow. If you must bury something, let it be my faults, my weaknesses, and all of the prejudice against my fellow man. Give my sins to the devil and give my soul to God. If by chance you wish to remember me, do so by a kind deed or a word to someone who needs you. And if you do all that I have asked, I will live on forever. Okay, I got through that part. That was pretty good. Some among you have received, or your children have received, heart transplants in the past year, and others a quarter of a century ago. Your donor families would be so proud to know that you were here and commemorating this occasion, and your lives keep their family members alive to them. Remember that. I too have tremendous pride in each and every one of you. You're like my own children. And I know that if you ask the rest of my team, they're all going to say the same thing. You're their children too. That's an incredible thing, isn't it? Most children are horrified to have two parents telling them how to behave, what to do, what to say, what not to say, and you guys have what, 10? I'd like to say thank you. As I look out and I look at every one of you, I'm really touched that each of you came and took the time to be here today. At a really inconvenient time, by the way. But you all really are my extended family. Thank you for being the source of my professional and my personal pride, and the reason for my perseverance in this sometimes really very hard job. Our anniversary is by definition a celebration of the past, and indeed we've had a lot of accomplishments to celebrate. Things have changed a lot in the past 25 years, but in some ways everything is remarkably the same. For 25 years, the process of organ transplant remains largely unchanged. Waiting times are still painfully long. We lose too many children to their diseases, and the patients have to wait patiently for weeks, months, sometimes even years for their child's second chance at life. Last week. No, actually, it's not true. Psych. We've had some advancements. I know you guys, we now know that we can safely cross barriers of blood type without sacrificing outcomes for infants needing heart transplants. We also have improved the quality of life in some children waiting for heart transplants with mechanical support valves. And indeed, this year not only marks the 25th anniversary of our transplant program, but also the 10th anniversary of one of the world's most successful Berlin heart VAD programs. The world of antibody detection has also evolved over the past 25 years, and today we enjoy much more knowledge about the immune system before and after heart transplant than ever before. This has led to some children receiving heart transplants who previously would not have even been considered candidates. And we're now able to recognize and treat antibody production more effectively than ever, and sometimes before it even causes problems. Despite these advances, though, so much is the same. Children can still run the risk of dying before their chance at a heart transplant. They still run the risk that they will reject their organ. They still run the risk of having some other problem like diabetes or kidney failure. They still have to suffer through endless blood tests, medical procedures, just making sure that their hearts stay in the best condition possible. So we have a lot of work to do. Let's take a moment not only to pride ourselves in the accomplishments of the program and each of you individually, but also look to the future. In the future, the pumps we use to temporarily support the hearts will evolve. They're going to become completely implanted. They're going to run on energy sources that are entirely within the body. They're going to become more durable, they're going to become less prone to complications, and they will become a way for us to end the need for adult heart transplant someday. Just wait. In the future, stem cells are going to help some children with weak hearts. I'm proud that our hospital is taking part in a study in which cord blood is being used to rejuvenate injured heart muscle in some babies after newborn heart surgery. In the future, there is little doubt that stem cells are going to have a role in healing some kinds of damaged hearts, and there are dreams of perhaps even growing new hearts from cells of one person whose heart's been injured by blood clots or infection. That's going to be revolutionary. In In the future, we're going to be able to look at the blood of heart and heart tissue of those prone to heart failure, and we're going to predict their heart failure before they become ill. The revolution of microRNA profiling is coming, and it's going to change the way we think about hearts that are prone to illness. And in the near future, we're going to be able to look at tissue from a cancer survivor and tell that patient whether their heart may fail or not in the future. This is not science fiction. It's practically here. In the future, donated organs will not go to waste. Good organs not immediately taken for transplant are going to be able to be banked as living organs so that someday you can pull a heart transplant off of the shelf, so to speak, and provide one right away. The machines that support living hearts already exist. This isn't fantasy, this is reality. It's just a matter of evolving technology. That's all I've got to say. The future's so bright, you gotta wear shades. Thank you guys for coming.
He brought those just in case you started crying, I can tell you. So, I would like to introduce a very special person. Melanie, are you here? So Melanie, for all of you children, this is what it looks like when you've had your heart for a long time. You grow up, and of course your surgeon isn't going to recognize you, so please send pictures at Christmas time because I'm lost. Melanie had her heart transplant in 1995, and I was told that she was on the list for a whole 4 days. Don't be jealous. But she said it was actually more like a week. She was on the list. So don't be jealous. Occasionally it does happen. She was 10 years old at the time. She has grown up, and she is currently a speech therapist up in San Francisco with the public school system. And we asked Melanie to give you a few words of her perspective of what it's like to be a heart transplant patient.
Hi. It's an honor to be here, and really a special privilege to be at the hospital for a party. So many people have fears and anxieties about coming to the hospital, but for me, this feels like coming home. I first came to Children's Hospital Los Angeles in the summer of 1995, and I was just 10 years old, clinging to life at the time. My cardiomyopathy had progressed so fast that when my name was added to the wait list, it did go straight to the top, and I was fortunate to have received my heart in 1 week. Thanks to Monica, Dr. Wong, and Dr. Starnes, that little girl lived, and I was just one of the first. Since then, over 100 lives have been saved here at CHLA by so many incredible transplant doctors and nurses. In my 23 years as a heart transplant patient, I've traveled the country and even the world in the hands of many care teams. Children's Hospital Los Angeles is unmatched in their excellence. I'd still be their patient had they not finally kicked me out after I turned 25. Not enough hospital beds, fine, I get it. But even after hitting the age cap and being admitted to USC's ICU for the first time, Dr. Menteer showed up every day at my bedside to lead my transition. Almost like a father getting their child settled into a college dorm, but with IVs and heart monitors instead of bunk beds and beer. As a pediatric patient, my transplant team here at Children's Hospital really was like a second family. When I didn't get labs drawn on schedule, Donna would call me multiple times a day, just like a parent nagging me to go clean my room. OMG, Donna, do I even really need labs? Yes, you do need labs. While studying abroad in France, I'd email Dr. Jackie, but instead of sending photos of me at the Eiffel Tower and asking for advice on boys, I'd send her photos of the shingles rash on my foot and ask for advice on which antiviral drug to take. No matter what was going on in my life, they were always there for me, keeping me healthy, strong, and able to pursue my dreams. Everybody knows that Children's Hospital Los Angeles saves lives. But our transplant teams do more than that. They help raise children to be resilient, responsible, and thriving adults. Because as we know, a transplant isn't only a surgery, it's a uniquely transformative way of life, and our transplant teams are there for us every step of the way. There will never be words to express our appreciation to each of you. To the ICU nurses who monitored our every breath and comforted us while our exhausted parents slept. To the social workers who supported our families and gave tough talks to rebellious teenagers. To the cardiologists and surgeons whose compassion and whose genius kept our hearts beating strong. And to the nurse coordinators who worked so diligently to ensure we were following treatment plans. We are living proof of your supreme dedication. Every day we celebrate life, our donors, our families, and today we celebrate Children's Hospital Los Angeles and this extraordinary heart transplant program. To all of you who've devoted your lives to saving our lives, we give you our deepest and most heartfelt gratitude. Thank you.
Thank you so much. So now I should have brought an extra set of shades. So I know that many of you are hoping that Dr. Starnes will be free to come down so that you can chat with Dr. Starnes. I am still working on that. He is currently in the OR in the middle of operating, and so I am still working on it though. I'm not uber hopeful, but I'm still trying. And I believe that this next phase, are we going to break up and do some photos? Did you want a group shot? All the patients. Okay, so where would you like to try to coordinate that?